Hospice is a term that I'm sure that all of us have heard, but maybe you don't fully understand what it is or when to use it, or have certainly noticed that it's quite misunderstood. So let's take a moment to talk about hospice and what it is. Well, first thing is actually that it is used to mean three different things. So no wonder some of us are confused. Hospice is a philosophy. It's a multidisciplinary approach to care, which is designed to ease the physical, emotional, and spiritual discomfort at the end of life. And so hospice is a philosophy. Hospice is also a team of people, a team of clinicians and providers who come to you wherever you are and to provide assistance at the end of life. So it can also refer to a group of people. And lastly, hospice is also an insurance benefit. It's available to people with terminal conditions whose expected prognosis is 6 months or less. So hospice can mean all of those things. It is a philosophy, a group of people, and an insurance benefit. Hospice really is about changing the focus from hoping for a cure to providing comfort. At the end of life, there's a point at which we're not going to be able to cure whatever is going on, and actually we should just change the focus to how can we make this person comfortable and to make their passage a lot gentler. And that is when hospice comes in. It's not giving up. It's about accepting what is happening. It's also often underutilized because people perceive it as giving up. They refuse to call hospice until the very last minute. And so often hospice is only in place for a few hours or a few days at the end of somebody's life, when actually hospice services are available to people for months, for 6 months, when they are projected to die within 6 months. If the disease that they've got, the conditions that they've got follow their natural progression, then hospice can actually be called for 6 months. And the reason that that's important is because hospice doesn't only attend to the dying person, it also is there for the caregivers to give them relief from caregiving duties. And so it can actually be extremely supportive, and if well utilized hospice can make the passage much easier for absolutely everybody involved. Something else to know and to keep in mind is that hospice isn't permanent. You don't check in and you're never allowed to check out. If you get better, you can leave hospice care. So you can join hospice, find that actually the care that they give is really supportive and helpful, and if you recover well enough and your diagnosis changes, your progression changes, and you're not expected to die within 6 months anymore, well then you can actually leave hospice. Medicare benefits even provide for being able to access hospice multiple times. And so it's not necessarily a bad thing. It's actually a really good thing to call hospice before you think that you need it, to get an assessment so that they can help you figure out what are the best services for you and for your caregivers. And it's not about giving up. It's about saying like, hey, this is what's going on, and let's pay attention to the patient and to the caregivers to make things easier for them and to provide that level of care and support that can make things just gentler overall. And that's hospice. I'd say if you think you might need hospice, go ahead and call and find out and have them help you make an assessment. And don't wait until the last minute, because then hospice really can't do much of anything.